Welcome to the deep dive. So, you've given us quite a bit of material here, articles, some research papers, notes, all focused on a topic that's, well, let's be honest, pretty scary, but really crucial for pet owners. Rabies.
It really is. It's a serious topic, and yeah, there's often a lot of fear, maybe some misunderstanding around it.
Yeah.
So our goal with this deep dive is to sort of unpack that using your sources.
Right.
You want to pull out the really critical information, how it spreads, what it looks like, and, the most important part, how we can prevent it.
Exactly. Because even though the outcome is, well, incredibly grim once symptoms appear, the story of rabies is actually all about prevention, isn't it? Understanding it is really the key to protecting our pets and ourselves.
Couldn't agree more.
So let's jump right in. What is rabies, fundamentally? Like, at its core?
Okay, so basically it's a viral disease.
Yeah.
The specific cause is a virus called the rabies lyssavirus.
Lyssavirus, okay.
Yeah, that's the genus it belongs to. It's part of a
Yeah.
larger family called Rhabdoviridae. You don't really need to remember all that taxonomy, but just know it's a distinct type of virus.
Got it. A specific virus. And how does it typically, get transmitted? How does it spread?
The main way, by far, is through the bite of an infected animal.
Yeah.
Or sometimes a really deep scratch,
Right.
because the virus is heavily concentrated in their saliva. So getting that saliva directly into a wound, that's the most common route for it to enter a new host.
A direct transfer, basically.
Well-
Are there other ways it can happen? Maybe less common ones?
Yes, though it's much rarer. It is possible for the virus to get in if infected saliva touches an open cut or mucous membranes. So think eyes, nose, mouth.
Ah, okay. Needs a way past the skin barrier.
Exactly.
So where does this virus hang out in nature? Are there specific animals that are the main reservoirs?
Yeah, and this is interesting because it really changes depending on where you are in the world.
Oh.
Yeah. So here in North America, the main reservoirs, the animals that mostly carry and spread it tend to be wildlife.
Yeah.
We're talking raccoons, bats, skunks, foxes. Those are the big ones.
Okay, wildlife.
But then you look at huge parts of Asia and Africa, and the main reservoirs and the animals actually spreading it most often are domestic dogs, usually unvaccinated ones.
Wow, that's a massive difference. So the risk profile really shifts based on geography. Given that, how do our pets usually get exposed then?
It's almost always through some kind of interaction with those reservoir animals we just talked about.
Right.
So either contact with rabid wildlife, or in those areas where it's common in dogs, contact with unvaccinated dogs or cats.
Okay, so the virus gets in. What happens next? This is the part about its journey through the body, right?
Precisely. And this is really key to understand why rabies is so dangerous. Once it's inside, the virus is what we call neurotropic.
Neurotropic. Nerve-loving.
Basically, yeah. Think of it like that. Instead of, say, traveling through the bloodstream like lots of viruses, this one specifically targets and travels along the peripheral nerves.
So the nerves branching out from the spine and brain.
Exactly. It uses those nerve pathways like a highway, heading towards the central nervous system, the brain and spinal cord.
That's kind of creepy. It uses the nervous system itself to travel.
It is. And how fast it travels can vary quite a bit. Could be days, could be several months. Things like how close the bite was to the brain or spinal cord and how severe the wound was, they influence the speed.
Right, like a bite on the face would get to the brain faster than one on the paw.
Exactly that. Much shorter path.
So, okay, it reaches the central nervous system. Then what?
That's where the really severe damage starts. It begins to multiply very, very rapidly inside the brain and spinal cord. This causes massive inflammation, what we call encephalitis.
Inflammation of the brain itself.
Yes. And this rapid multiplication and inflammation is what leads to those profound neurological symptoms that we associate with rabies.
So it invades the body's control center and wreaks havoc.
Pretty much. And then here's another really crucial part of its cycle. After multiplying in the CNS, the virus then travels back out.
Back out.
Yeah, centrifugally away from the center, down other nerves, and specifically, it heads to the salivary glands.
Ah.
And that's the critical step for transmission. By reaching the salivary glands, the animal becomes infectious and can spread the virus through its saliva.
So it goes in via nerves, up to the brain, multiplies like crazy, causing the illness, and then travels back out to the mouth so it can spread again.
Wow. What's a typical timeline? Exposure to actual symptoms showing up?
We call that the incubation period. In pets, it's typically somewhere between, say, 2 weeks and 3 months.
Okay.
But, and this is a really important point for how we manage potential exposures, it can sometimes be longer. And what's really tricky is that an animal can actually start shedding the virus in its saliva, becoming infectious, in the few days before any obvious clinical signs are visible.
Oh, wow. So they could look completely fine but already be contagious? That's scary. It is. It makes detection and prevention really challenging.
Okay, so when the symptoms do finally appear, what do they actually look like?
Well, they're almost entirely neurological and behavioral, which makes sense given the virus attacks the brain. They usually progress through a couple of fairly distinct stages, though, not every animal follows the exact script.
Right. Let's walk through those stages. What happens first?
The first phase is called the prodromal stage. This one is often quite subtle, and it might only last, say, 1 to 3 days.
Subtle how?
You might just see some vague behavioral changes. Maybe the pet seems a bit more anxious or restless, or maybe more withdrawn than usual. Physically, maybe a slight fever, not eating as much, or sometimes they might excessively lick or chew at the bite site if there was one.
That sounds incredibly easy to miss, doesn't it? Or just chalk up to something else.
Oh, absolutely. You can easily think, he's just feeling a bit under the weather today, especially if you have no idea they were exposed. It's the easiest stage to overlook.
Okay, so if that subtle start is missed, what comes next?
Often, the next stage is the furious stage. This is the one most people think of when they hear rabies, and it tends to be more common in dogs.
Furious stage. Sounds bad.
It is. This is where you see extreme behavioral shifts, particularly aggression. An animal might become suddenly irritable, very agitated, snapping or biting at anything, air, objects, people often totally unprovoked.
Wow.
You also see things like hyperexcitability. They seem disoriented. Their pupils might be dilated. They become sensitive to light and sound. And difficulty swallowing is a big one here.
Difficulty swallowing? Does that lead to the phoning?
Yes, that's often what causes it. They can't swallow their saliva, so it pools and might look like foam or excessive drooling. Though it's worth noting, foaming isn't only caused by rabies. Seizures can happen in this stage, too.
So their whole personality can just flip. They become unpredictable and really dangerous.
Exactly. Even the sweetest, most docile pet can become a serious threat during the furious stage. It's heartbreaking and dangerous.
And the final stage, after furious.
That's the paralytic stage. Sometimes it's called dumb rabies. Here, the dominant feature is progressive paralysis.
Paralysis starting where?
Often starts in the limbs. You might see incoordination. Weakness, vets call it ataxia. A really characteristic sign, though, is paralysis of the muscles in the throat and jaw.
Oh, so they can't swallow at all.
Right. Leads to that sort of slack-jawed look, excessive drooling again, but without the agitation of the furious stage. The paralysis then spreads through the body, leading to coma, and eventually death happens because the respiratory muscles fail. They just can't breathe anymore.
That's just devastating. And you mentioned earlier some animals might skip the furious stage.
Yes, that definitely happens, particularly noted in cats sometimes. They might go from those early subtle signs or maybe seem fine and then just become progressively weak, lethargic, and paralyzed without ever showing that extreme aggression.
So let's just really underline this point. Once any of these clinical signs appear, prodromal, furious, paralytic, once you see them,
The outcome is, for all practical purposes, invariably fatal. There's really no going back at that point. No effective treatment can reverse the disease once symptoms start.
such a harsh reality. Which naturally leads us to diagnosis. If it's hard to spot early and fatal once signs appear, how on earth do you diagnose it?
Yeah, that's a major hurdle. Getting a definitive diagnosis in a live animal. Extremely difficult, bordering on impossible, especially early on.
Why is that?
Well, those early symptoms are so nonspecific, right? They could mimic dozens of other things, other neurological diseases, infections, even just feeling generally unwell. There's no single simple blood test or scan you can do on a living pet that says, yes, 100% rabies.
Okay, so if a vet suspects rabies in a live animal, what do?
It primarily relies on what we call antemortem diagnosis, trying to diagnose before death. It's heavily based on the clinical signs they're observing, plus, and this is critical, the animal's history.
Like, was there a possible exposure?
Exactly. Did it fight with a raccoon? Was it bitten by a stray dog? Based on that suspicion, the standard approach in many places is a strict quarantine period, usually 10 days, for observation.
10 days. Why 10 days specifically?
It goes back to what we discussed about the virus shedding. The science shows that if an animal was infectious enough to transmit the virus at the time of biting someone or another animal, it will almost certainly develop undeniable clinical signs of rabies within that 10-day window.
Ah, I see. So if it stays healthy for 10 days after the bite.
Then it's highly unlikely it was shedding the virus when the bite occurred, and therefore couldn't have transmitted rabies at that moment. It's a crucial public health measure built around the virus's biology.
Clever. Are there any lab tests they try on live animals, even if not definitive?
There are some advanced tests, yes, usually done in specialized labs. Things like PCR tests to look for the virus's genetic material, or fluorescent antibody tests. They might try these on samples like saliva or CSF, that's the cerebrospinal fluid around the brain and spine, maybe even a tiny skin biopsy from the neck area.
But they're not foolproof.
Not always, no. Especially early on, the virus might not be detectable in those samples yet. Results can take time, and they aren't always conclusive while the animal is alive.
So the definitive gold standard diagnosis usually happens later.
Yes, the truly definitive diagnosis is made post-mortem after the animal has died or has been euthanized. The standard test is called the direct fluorescent antibody test, or DFA.
How does that work?
It involves examining fresh brain tissue samples under a special microscope. They specifically look at parts of the brain the virus targets, like the hippocampus, cerebellum, and brainstem. The test uses fluorescent antibodies that will bind to rabies virus antigens if they're present, making them glow.
So it directly detects the virus in the brain?
Correct. There's also histopathology, looking at stained brain tissue slices under a regular microscope. Sometimes you can see these characteristic things called Negri bodies. They're like little clumps of virus material inside the nerve cells. Seeing those is highly suggestive, but the DFA test is considered more reliable and sensitive.
And because rabies is zoonotic, it can jump to humans, this testing isn't just about the pet, right? It's a public health necessity.
Absolutely critical. That's the bottom line. If any pet dies or needs to be euthanized under circumstances where rabies is even a remote possibility, testing is usually required by law. It's vital for identifying if any humans or other animals were potentially exposed and need follow-up.
Okay, that grim prognosis post-symptoms leads us to treatment. What are the options?
And this is where the message is just incredibly stark, but it has to be said. Once those clinical signs of rabies appear, the disease is essentially 100% fatal.
No cure, no treatment that works at that stage.
No effective treatment exists, unfortunately. Once the virus has reached the brain and started causing symptoms, medical intervention is really just palliative, trying to keep the animal comfortable, if anything. But the disease progression is unstoppable.
So once you see symptoms, it's too late for any cure.
That's the harsh reality. The entire focus has to shift away from treating the sick animal to preventing any further spread and managing anyone or any other animal that might have been exposed.
Right. So if treatment is off the table once they're sick, what happens if a pet is exposed, say, bitten by a potentially rabid animal but isn't showing symptoms yet? How do you manage that situation?
Okay, this is where the pet's vaccination status becomes absolutely paramount. It completely changes the approach. Let's take the worst case first. An unvaccinated pet gets bitten or scratched by an animal confirmed or highly suspected to have rabies.
That sounds like a nightmare scenario for an owner. What's usually recommended?
Honestly, because the risk of that pet developing rabies is so high and the subsequent risk to humans is so significant, euthanasia is often the recommendation from public health officials.
Wow, that's tough. Is there ever an alternative?
Sometimes, depending on local laws and the owner's ability and willingness to comply with very strict measures, an alternative might be considered. This usually involves an extremely rigorous quarantine, potentially lasting up to 6 months.
6 months.
Yes, because of that potentially long incubation period we talked about. The pet would typically get a rabies vaccine dose immediately, and then boosters during the quarantine. But it's a huge undertaking, expensive, stressful, requires total isolation, and there's still no guarantee the pet won't develop rabies during that time.
That sounds incredibly difficult. Okay, what about the flip side? What if the pet was properly vaccinated against rabies?
Now that's a much better situation, thankfully. If a currently vaccinated pet is exposed, the protocol is quite different.
What do they do?
The standard recommendation is to give the pet a rabies vaccine booster shot right away. This helps ramp up their existing immunity quickly.
Okay, a booster. And then?
Then they're typically placed under observation, usually for a period of 45 days. During this time, they need to stay healthy and be kept under the owner's control leash walks only. No roaming.
So not the long, strict quarantine?
No. Because the animal was already vaccinated, their immune system is prepared to fight off the virus. The risk of them actually developing rabies and transmitting it is considered very, very low. But that 45-day observation is still an important precaution.
Man, this just hammers home that prevention really is everything with rabies.
Absolutely. It's the cornerstone. Prevention is the single most effective tool we have to protect both our pets and ourselves from this horrible disease.
So what are the key prevention strategies for pets?
Number one, without a doubt, is vaccination. Rabies vaccine is considered a core vaccine for both dogs and cats.
Meaning, essentially, all of them should get it.
Yes, regardless of whether they're indoor or outdoor pets, exposure can happen unexpectedly, like a bat getting into the house. Puppies and kittens usually get their first shot around 12 to 16 weeks old.
Okay.
Then they need a booster 1 year later. After that, boosters are typically required every 1 to 3 years. The exact frequency depends on the type of vaccine used and, crucially, your local state or county laws.
And it's often legally required, right?
Right. In many, many places, yes. Rabies vaccination isn't just a recommendation, it's the law. And for good reason.
So keeping vaccines current is job one. What else?
Responsible pet management is also really important. Simple things like keeping pets indoors or supervising them closely when they are outside, especially around dawn and dusk when some wildlife carriers are more active.
Limit their chances of encountering wildlife.
Exactly. Also, resist the urge to feed or handle stray animals or wild animals, even if they seem friendly. And teach children to do the same. If you see any animal acting strangely disoriented, unusually aggressive, or maybe unnaturally tame, keep yourself and your pets away and report it to animal control or your local health department.
Makes sense. And what about precautions for us humans?
Good point. There are definitely human precautions. For people in high-risk jobs, vets, vet techs, wildlife rehabilitators, lab workers dealing with the virus, there's something called pre-exposure prophylaxis, or pre-EP.
Pre-exposure. So getting vaccinated before any potential bite.
Correct. It's a series of shots that builds immunity just in case. And then, critically, for anyone who gets bitten or potentially exposed by an animal that might have rabies, there's post-exposure prophylaxis, or PP.
What does PP involve?
Immediate, thorough wound washing is the first step. Soap and water. Flush it well for several minutes. Then, seek medical attention right away. PP usually involves getting a dose of rabies immune globulin, basically, preformed antibodies injected near the wound site if possible, plus a series of rabies vaccine shots over a couple of weeks. The goal is to neutralize the virus before it can reach the nervous system.
So this really isn't just an individual pet owner issue. It's a coordinated public health effort.
Absolutely. Rabies is what's known as a notifiable disease pretty much everywhere. That means any suspected or confirmed case must be reported to public health authorities immediately.
And vets are key in that.
Vets play a huge role. They have legal and ethical obligations regarding quarantine procedures, reporting suspected cases, and sometimes making that difficult decision about euthanasia when it's necessary to protect human health. A rabid animal is a direct public health emergency.
This has been incredibly informative, really digging into a tough but vital topic. I think the main takeaway, the big message, feels crystal clear. Rabies is devastatingly fatal once symptoms start, but it's almost entirely preventable.
That's exactly it. That's the crucial message to hold on to. The real power here lies in prevention. Consistent vaccination is key, being a responsible owner by minimizing risky encounters for your pet, and just being aware of the rabies situation in your local area.
And recognizing the vet's role in all this diagnosis, reporting, education.
Absolutely. They're on the front lines.
It really drives home that profound link between animal health and human health, doesn't it? And it kind of leaves you with this thought. Given that treatment just isn't an option once those symptoms begin, how does that fundamental truth, that stark reality, change how we need to think about controlling diseases like this, ones that bridge the gap between animals and humans?
Yeah.
It really forces the focus, doesn't it? Not just on finding cures after the fact, but on the absolute non-negotiable necessity of preventing it, of stopping it completely before it even gets a chance to start.
That's a really powerful perspective and absolutely spot on for rabies.
Indeed. Well, thank you for walking us through all of this. It's been a vital deep dive. To everyone listening, stay informed, keep those pets protected, and stay safe out there.